Urinary tract infections, also known as UTIs, can cause many potentially life-threatening complications. In fact, approximately 25% of all adult sepsis cases are a result of urosepsis. So it's important to catch this infection quickly and identify which antibiotic option would work best to prevent such complications from occurring. So with us today is Christ Hospital urogynecologist and pelvic surgeon, Dr. Mickey Karam, to tell us about an advanced diagnostic test that's really showing great results. Welcome.
Thank you so much for having me.
Oh, no, thanks for being here, because I think this is something, and I'm so glad we could talk about these things today, because this is really important for women. Let's just talk about what is a UTI? What is a urinary tract infection?
So I think even before I answer that question, it's important to understand this dialogue that we're having this morning is about women. And 80% of the statistics you just talked about occur in women. And historically, unfortunately, the way we've studied and understood UTI has been based a lot on male anatomy. And so, you know, the gender divide is at the forefront here. But with that said, basically a UTI is when a bacteria or fungus enters into the urinary tract and starts to cause inflammation, and basically patients start to complain of frequency, urgency, pain as the urine passes through the urethra, and it's a very distressing problem. And it's really flown under the radar. Even at the medical level, it's been taken sort of nonchalantly. Patients get empiric antibiotics. The standard way of diagnosing this is very suboptimal.
And let me tell you, I mean, I'm going to be honest, when I was pregnant with my first daughter, and even my second one as well, I got several UTIs. I had never suffered from one, and I didn't really know what was happening, but I knew something down there wasn't good, and then it just came in with a vengeance, and the pain, and it felt, I'm not kidding, it felt like a knife, and I thought I was going to have to go to the bathroom and nothing would happen, and I ran to the doctor. I started bleeding. I mean, the quality of life can immediately just tank, right?
Absolutely, and that's unfortunately what happens a lot, and the whole goal of our discussion this morning is to bring to the forefront the fact that the way we've traditionally diagnosed and managed these patients is suboptimal. A standard urine culture, which is where you pee in a cup and they send it off to a lab and it takes, 2 to 4 days to get results, is okay in patients that have infrequent infections, but so many women, about 20% of women that have UTIs, it's recurrent, complicated. It keeps coming back, and it's very frustrating for the physician and the patient, because you just keep throwing antibiotics and you get into this vicious cycle, because the more antibiotics you throw at them, the more resistance you get to antibiotics.
And then you get a yeast infection.
And then you alter bacteria in your vagina and in your gut, so you either get diarrhea or a yeast infection. And that's the reality. It's one of those disease states that hasn't been taken seriously like it should.
So, doctor, walk me through the difference between the standard urine culture and Guidance UTI.
So basically, this doesn't require any different way of collecting the urine. You basically urinate into a cup, and it gets sent to the Diagnostics lab, and literally the next day you'll have the results, versus a standard urine culture. In my world, I'm lucky if I have the results in 4 days. They'll say it's available in 2 days, but at times the bacteria isn't growing out like it should, et cetera, et cetera. So literally the next day you'll have the results with this, and it doesn't require a catheter or anything like that. They just urinate into a cup.
And the results are more accurate, doctor, in terms of the other way?
That's an understatement. Not only more accurate in the different potential bacteria and fungi that are growing in there, they provide you with a very, very clear-cut understanding of what is the best antibiotic to treat. And the other thing that I didn't mention early on is standard urine cultures pick up only about one organism usually, maybe two. We know that up to 30% of urinary tract infections are what we call multibacterial. There's many different bacteria causing it, and this specific test guidance will show you it's growing out this bacteria, this bacteria, this bacteria, and all three are sensitive to this antibiotic. Like I said, it's been game-changing.
What a game changer, especially for women who have been suffering month after month after month after month. Within a day or so,
And again, not only suffering, having to ingest all of these antibiotics time and time again. And the antibiotics don't just impact the urinary tract, they impact your vagina. We talked about causing yeast infections. They impact your gut. And then on the medical side, you're creating lots of resistance that occurs against these antibiotics, so they're no longer as effective down the road. And so it's truly a vicious cycle that's getting to be a crisis.
Doctor, this is great information. For our viewers who'd like to learn more, where can they go?
They can go to pathnostics.com. There's a very, very nice description of the testing, and it's very patient-friendly. They can also Google Guidance UTI, and a lot of information will come up. And I just want to underscore as well that this specific company has really invested the time and money to do very good scientific research around this testing, and that's out there in the public domain for the providers as well.
Thank you, doctors. Thank you for the information. Appreciate your time.
Thank you.
And if you'd like more information, you can go to our website, thebalancingAct.com. We'll be right back.